Maria, down to you.
All right, thank you so much. Welcome to our two-part health panel series with the doctors from Nevada Eye Physicians. June is Cataract Awareness Month, and here to tell us more about the condition and how to treat it are Drs. Surjeet and Dr. Derek with Nevada Eye Physicians. Doctors, thank you so much for joining us.
Well, thank you for having us. We appreciate it.
Yeah, I think the first thing we need to know, cataracts, and who is affected by it.
So, cataracts is a natural aging change of the eye. All human eyes have a lens inside the eye. We're all born with a lens, and with time, due to changes in the natural composition of the lens, it can become cloudy. Okay. So when your natural lens becomes cloudy, it's called a cataract. So it's not any new growth of tissue inside your eye, it's what you already have has now become cloudy.
And let's talk about some of the symptoms.
So some of the symptoms you can have with a cataract, early on it's mostly nighttime driving. You get that glare, you get the halos around lights at nighttime when you're driving. Sometimes you need more light to read. Later on, it just affects overall the quality of your vision. The color perception goes down, as well as just the overall quality of your vision will start to drop, and you'll start to lose, lines of visual acuity.
And let's talk about who this affects.
So it can affect anybody, but the predominant cause of cataracts is the natural aging process. So we usually see cataracts in the older population, people over the age of 60. It's one of the leading causes of vision loss. But some people who might have taken steroids for some reason, have had trauma to the eye or the head, can get cataracts. Even diabetics can get cataracts at a younger age.
And let's talk about nowadays the treatments. I'm always amazed when I go into a doctor's office and they have this new technology and all these machines. Is it easy to detect, or what? They can go into your office and you guys have free screenings?
Yeah, exactly. So a cataract is very easy to detect as far as a clinician goes. I can look in your eye, or we can look into your eye, and we can see a cataract right away. And you may not be noticing the cataract right in the beginning, and sometimes we'll say, yeah, you have a cataract because you have a cloudy lens, and we can see that through the microscope. And it's pretty easy to detect. It may not be affecting you at that point, but it's something to start watching for at an earlier time so we can see how it's progressing. Some people's cataracts progress slowly. Some people's cataracts progress rapidly. So initial visit, which we do all the time, and we do offer free screenings for the month of June, and come on in and we'll take a look at it to determine if you have one or not.
And the screening, how long does it take?
We can do that in less than 15 minutes. The exam's going to take less than 2 minutes. Paperwork might take another 10. So you'll be in and out. Yeah.
And what I love is you guys have locations all over the valley, as well as in Pahrump. And where else do you have locations?
So we've got 8 locations, 6 in the valley. So we're in Henderson, North Las Vegas, Summerlin, all over town. And then we're in Bullhead City, and Dr. Neibauer also goes to Pahrump.
Yeah, okay, we have all that information up there. Do you recommend that they call for an appointment, or should they show up during the screening hours?
No, just call. We have a special line dedicated for the screening.
Okay, and you will be coming back. I'm glad that you're staying around. We have a lot of questions for you. Tell us what you'll be talking about in your second segment.
Well, we'll be talking about treatment of cataracts. We have the most cutting technology at Nevada Eye Physicians. We'll be talking about the laser and how we use the laser to treat cataracts.
Okay, gentlemen, thank you so much, doctors, for being here. And they are sticking around. You can chat with the doctors online at fox5vegas.com/more. All right, Jason, over to you.
Okay, thanks, Maria. Well, they were